While the rest of the UK tightens its immigration rules, Scotland opens its doors, and not with slogans, but with real support for health and care workers who have been left behind as a result of changes in immigration policies.
As well as being morally wrong, Westminster's race to the right is also deeply damaging to our society. The number of nurses the National Health Service was able to recruit from overseas fell by 80% last year. 80%. And in July, Westminster shut down the visa route for social care workers. They even withdrew job offers that had already been promised. As a result, thousands of care workers here in the UK, entirely legally, have been left high and dry, unable to work, while care homes are crying out for staff. In what world does that make any sense whatsoever? Well, delegates, I've got a solution. I can announce today that the Scottish Government is stepping in. We will sponsor these skilled staff so they can work, pay tax and help keep Scotland's care homes running. Hundreds of dedicated workers able to start work immediately. Scotland's older people must not pay the price for Westminster's prejudice.
That clip you just heard is from Scotland's First Minister during the SNP Conference a few days ago, just last week, basically. And it is part of a bigger story. The Scottish Government has announced an investment of £500,000 to support international care workers that have been displaced as a result of changes in immigration rules. In the past year alone, the number of health and care worker visas that were issued fell by about 88%. And when the UK government announced the closure of this route, for the carers and senior carers from overseas, that number fell even lower. And some people, according to this article, says thousands that were already in the UK and were sponsored were left stranded because of these changes. And these people already had job offers, but probably because the employer couldn't meet certain criteria, or just one or two things happened and they lost the sponsorship that they already had. The article confirmed that care homes are crying for staff. The elderly people need care and support, and yet there are people that are already trained, they have the experience, that have been pushed out of their jobs because of these policy changes. But in Scotland, this is different. The tone is different because more than a quarter of their workforce are international staff, and these are the people that keep the system running every day, according to that publication by the Scottish Government. And instead of turning these people away, Scotland is saying, we will support you, we will cover your relocation cost, we will help you find a job and give you a fresh start before Christmas. Now, if that is not nice, I don't know what you will call it. But let's keep listening as we go, and we'll get to understand more as things unfold. But this conference obviously wasn't just about carers and senior carers. It was also about the kind of country that Scotland wants to be. It's about the kind of country that Scotland already is. Fairness, a place that still believes in fairness, opportunity, and care for everyone that calls it home.
Just look at what we are achieving. Free childcare provision more than doubled. Council tax bills lowest in the UK. Water bills lowest in the UK. Income tax, most paying less, the highest earners paying more. Prescriptions, free. University tuition, free. Bus travel, free for under 22s. Peak fares on our trains, gone and gone for good. Waiting times down. GP numbers up. Record numbers of hip and knee operations on our streets. Crime down. In our schools, literacy and numeracy up. Record numbers heading to college or university and conference. Child poverty in Scotland at its lowest level in 3 decades. That is the SNP record. That is self-government making lives better in Scotland.
These are policies that show what the government stands for. But that is not all.
One key issue is the ATM rush for appointments. We want to make it easier for people to see a GP where and when it works for them. That's why I can announce today that the SNP government will open a nationwide network of walk-in GP services based in your community, on your local high street, near your child's school or close to your workplace. They will break from the status quo. They will add to the care we already value, staffed by GPs and nurses, open from 12 noon to 8 p.m, and you won't need to call up for an appointment. That means more people can go after work when it fits with their lives. And to make that even easier, they'll be open 7 days a week. This is just the start. We will expand this network, but it will begin with 15 sites across Scotland. They will deliver over 1 million additional GP and nurse appointments, and the first will be up and running within the year. That is personalised care on your doorstep. That is self-government working.
This move is designed to make healthcare accessible for everyone in Scotland, and especially for those who cannot wait weeks for appointments. Most of you in the UK know how sometimes it can be very difficult to get a GP appointment. If you call even a minute late, you might have to wait till the next day, or sometimes the waiting list is so long and you might have to wait till another day. And some cases are urgent. You really need to see a doctor without having to go to emergency. You get what I mean? So Scotland is trying to introduce these walking GP services just to make healthcare easily accessible for its people. And I really commend that move, because when it kicks off, most people that live in Scotland are going to see a massive difference in their healthcare system and all.
No one else will do a better job of caring for this beautiful country and the people who live here. And I mean all the people who live here. Wherever you are from, whatever your faith, whatever the colour of your skin, let me make this clear. We are all citizens. We all have a part to play and a contribution to make. And Conference, yes, I am proud to say that refugees are welcome here.
Wherever you're from, whatever your skin color, you are all citizens and you have a part to play in Scotland. This is a country that is welcoming everyone. I keep calling it a country because we all know that the United Kingdom is made up of 4 different countries. Yeah, Scotland, England, Wales, Northern Ireland. So I'm right to call Scotland a country. I feel very proud to live in Scotland because there are so many things that I would say we find it easy in Scotland as compared to other parts of the UK. Obviously, I've not lived in other parts of the UK, but I've heard and I've listened to testimonies of people that have lived in other parts, and I can boldly say that I would prefer to remain in Scotland. You get, yeah, I like where I am. Now, about the funds, the £500,000 investment that Scotland is planning to push into supporting displaced international care workers. There is no information on how this is going to operate in practice. The full details of that proposal is yet to be published, as well as how everything is going to play along, the jobs and all. And it is important for you to remember that Scotland is still part of the United Kingdom. So invariably, it's still controlled by the UK's immigration rules. Hence, this whole scheme is not about recruiting from overseas, because as we know, this route has been closed for people that are coming from outside the UK. But if you're if you're in the UK, you can still switch from other visa categories. Hence, it is only for those that are in the UK. It is not a recruitment scheme meant, from what I understand, it is not a recruitment scheme that is meant to recruit people that are not in the UK at the moment. Like I said, full details will likely be published, and then we will know what angle this proposal and this plan is going to follow. And if I may say rightly, I think it is targeting mostly people that have lost their sponsorship. Remember, when this rule came into force, it was announced that the requirement to recruit first from a pool of people that have lost their sponsorship has now been stopped. But That is what Scotland is trying to revive, because they feel like all these people are there, they have been trained, they have the experience, they are stranded. And for some of them, it's no fault of theirs that they've lost their sponsorship. These are the people we want to bring to Scotland to come and help our older population. The only thing I was able to catch from another article I read, or a publication I read from healthandcare.scot, I was able to get the information that the first set of people would be starting their roles before Christmas. So they'll be expected to start before Christmas. Everything would unfold and we'll get to understand as we go along. It is rare, very rare, especially in recent times, to hear government talk about immigrants and care workers as not a problem, but as part of the solution. And maybe, just maybe, that is what makes Scotland different. So, in the meantime, there are still openings in the NHS if you're within the UK. If you need jobs in Scotland, you can check NHS Scotland website. I have some videos I've done on this channel about where you can access some of these links, and maybe if you go through, you'll be able to know which one you want, if it's the NHS or care homes. I have about 2 videos, if I'm not mistaken, on the channel that talks about care home recruitment, and then another video comprehensively that talks about the NHS recruitment. So check and see what works for you, and I wish you the very best. I always forget to ask people to subscribe. I do it at the end of the video, and I don't think it's very good practice. But if you have watched up to this point, please, and you've not subscribed, kindly hit that subscribe button, like this video, share it to your friends and family, and everybody who cares to hear about this information. And I'll see you in my next video. Bye for now.